seems clear that COVID-19, among other things, has laid bare and magnified many of the systemic social and societal challenges we continue to have. Poverty, polarization, inequality, injustice, mental health issues. And arguably the events of the past couple of weeks can be considered to some extent exacerbated by the pandemic. In the report, we've tried to highlight the lessons and opportunities that can flow from this crisis if we choose to embrace them. We've seen how leadership failures and sort of relative disinterest on a number of levels in a number of regions have obstructed our response to other imminent existential threats, whether that be climate change, healthcare access, homelessness, you name it. And a key and perhaps obvious takeaway from the COVID crisis is we can't continue to wait until known issues become acute before we deal with them. We won't be able to social distance our way to success when some of the predicted threats around climate change become acute, for instance. But the report also highlights inspiring examples of courage and action from healthcare professionals and frontline essential workers stepping up to do their jobs despite the risks, to all the organizations and people pitching in to help in whatever ways that they can.
Yeah, absolutely. And now we just maybe need to look at how we sustain that energy and that focus and impact that we delivered in crisis mode. The challenge we're seeing now is that people have kind of this COVID fatigue. They're not clicking on emails that say COVID, for example. They're not wanting to consume news as often or as voraciously as they were on this topic. And so, particularly as other crises emerge and become more top of mind, how do we sustain that energy? That's one of the questions.